Hi everybody, this is through MEDIVO. MEDIVO is an innovative app which brings the patient to the doctor and the doctor to the patient even at home. You need not walk into a doctor's clinic. You can have your consultation happily sitting at home. I personally consider MEDIVO as a very useful app for my post-operative patients, especially after fracture surgeries or any major surgeries. It's very difficult for patients to contact the doctor for small doubts like how to keep the leg, can I turn this side, can I turn that side, what sort of food can I have, I'm having sudden pain at this point. All these questions can be answered only by the doctor. It cannot be answered by other people, and even if other doctors are there, they cannot answer. Only by the operating surgeon, the person who has done the surgery, can give a better answer. Thanks to MEDIVO. MEDIVO brings me close to my patients, especially post-operative patients, and it's very useful for them and very satisfactory when they get their answers instantaneously. I'm Dr. Prasad, orthopedic surgeon. Today I'm going to give you a small brief about fractures and injuries. It's very common to have an injury at home, at your workplace, either you or someone, or on the road per se, a road traffic accident or anything. As a doctor, we classify it only mainly into two types. Whether it's an open one or a closed one. What do you mean? A closed one where there is just fracture inside and no blood outside, it's not open. Whereas an open fracture, it's fractured, bone is jetting out, or there is a lot of bleeding from that place. That's called an open fracture. Open fractures are more common with road traffic accident or accidents at building sites and other major injuries. Home, domestic injuries and workplace related injuries are mainly closed fractures, except machinery injuries. Machine injuries, you commonly get the cut injuries over the hand and all those things. What is the first type? In a case of a closed fracture, when you don't see any blood, you feel your bone is injured. You had a sudden fall at your house, you slipped onto some small watery area, or when you're coming out of the washroom, you just had a slip, you're having some pain, you landed on your hand, landed on your shoulder or on the leg. More common is the ankle twist. The first thing you need to do is safeguard your limb. How to do that? Wrap it up with a towel or wrap it up with a thin cloth or anything, preferably with some ice. You can remove the cloth, give some ice and again wrap it up. If the limb is dangling, if there is a through and through fracture and you feel the limb is dangling, then have an external support. Have even a simple scale. You can have a small scale like this and you can tie it up with the towel or whatever you have, so that it gives a support to your hand or to your leg, and then go to the nearest hospital and go to the emergency room and they'll take care of you. So the primary thing is go as fast as you can to a doctor and consult and come to a conclusion. There is a diagnosis. What's your real problem with the hand after the fall, and then go ahead with the treatment. Next, open injuries. Open injuries also we treat in the same way. If you encounter anybody, you're traveling on the road, you're seeing someone getting involved in an accident, his or her limb is broken and it's an open injury, you see active bleeding there, try to get a clean cloth. Please don't put any messy or greasy cloth on top of that, and already the wound will be dirty because it's an accident which has happened on the road. On top of that, don't put a dirty cloth or something and make it more dirty. You can have a clean cloth wound around the bleeding area and you can safely transport the patient immediately to the nearest hospital for a better care.